for a well-articulated talk on uh, Ayurveda and music for wellness. It was very
Thank
well
you. Thank you.
presented. And before I go into, expressing my views on this uh, topic, I think I would like to first, you know, uh, start by the points of agreement. I'm sure everybody here and those of the participants who have joined us online uh, will attest to the fact that listening to music, which particularly the favorite music in any form, be it instrumental, be it vocal, and any mode of listening, whether it is through your mobile phone or on your TV set or on a iPhone or iPod, or whether you go for the channel, whether it is YouTube or Spotify or whatever you use. Uh, Anybody listens to their favorite music. Music can improve their music helps it helps them, elevates their mood after a whole tired day at hectic day at work. Once you come home and just listen to music of any kind for 5 or 10 minutes, the entire, you're able to one can get back to, it energizes as well. So that is about the wellness potential of music. And unfortunately, the therapeutic potential of Indian music has not been harnessed enough by our own, people. Uh, India has a vast heritage of uh, music, but and all of us, have been musically inclined in some way or the other. Uh, Even those who are not trained in music, even the villagers are exposed to some kind of music, be it folk or whatever form of music. It could be the bhakti sangeet or the bhajan format, it could be the abhangs, or it could be whatever. Everybody is exposed to music. But when it comes to the therapeutic angle, if we look at the available texts pertaining to music therapy, we have some inscriptions of which date back to the Sangam era, where the Tevaram and the Divya Prabandhams, of the Shaivite saints and the Vaishnava Alvars, was used for therapy. But because of the wide variety, probably people have used music a lot for entertainment, a little lesser for the therapy, or they have employed it for therapy, and they have really not published the benefits of the Indian music therapy enough in the various scientific fora. It has not been researched sufficiently. So just going back to my personal experience, I will start back with my experience with bronchial asthma. And having been an asthmatic, learning music has been more like practicing pranayama. And that has really helped me to stay well for so long. And I can say asthma doesn't trouble me much. It troubles me only once in a way. In fact, uh, being an ENT surgeon, the ENT department was in the forefront during this pandemic, and the earliest samples for COVID testing, the first samples for COVID testing were taken by the ENT surgeons until we trained others to take the samples. And, much before anybody else was exposed to the virus, I was exposed to the virus. But then, daily practice of uh, music helped me. And even when I got the disease, much later into the pandemic. Maybe it was almost 2 years after the disease came in that I got the disease. I did have some problem with my lungs because of the disease, but then because of music, I could get over the problem. And being a having worked in the COVID intensive care units, I have given some form of music therapy as well as meditation and mantra to the patients in the COVID ICUs and the COVID ward, and also done a lot online during the pandemic. And I have seen how it helped people to get well on first hand. My experience with music therapy is more in the palliative care scenario, where I have uh, helped people who are chronically ill, and from then on, deteriorating into the terminally ill phase, and then going on into the end of life care. And I have found that music promotes a lot of emotional wellness in not just the sufferer, but or the one who is terminally ill, but also the caregivers for whom the stress of taking care of someone who is in the palliative care scenario, chronically ill situation, and a loved one who progresses from that chronically ill situation, where all treatment is only going to help to reduce their pain and improve some kind of quality of life, uh, but there has no curative role. The burden on the caregiver, the stress is so much. So when we give music for them, it really creates a sense of uh, well-being for them, and they feel much calmer and less stress-free. As pointed out already by Dr. Shubham, music definitely has a positive impact on stress. It reduces depression, it reduces anxiety, and it is perhaps the only stimulus which can activate every part of the brain, not just one part. There are certain stimuli which will activate only the frontal lobe or the hippocampus, but music has the capacity to activate every part of the uh, brain, and thus all the pathways or the connections which are associated with every part of the brain, it promotes the well-being of every each and every pathway, and thus it promotes, it stimulates those uh, wellness hormones, the dopamine and serotonin, and thus it helps us to stay always happy, stay positive, and also it increases the inner uh, strength. Now, suppose somebody practices music. Indian music also has a component of improvisation. So, when we practice music, so it also promotes the creativity, and creativity is again something which contributes to a lot of mental well-being and physical well-being. So when we do the alap, or when we do the kalpana swara prastaram, or when we do a ragam tanam pallavi, there is a lot of improvisation, a lot of creativity in that. So whenever we do anything that is creative, it need not be music alone. If it's any form of fine arts, it contributes to both physical and psychological well-being. And when we are physically well and psychologically well, these things help in increasing productivity. It betters human functioning, and it helps us to deal better with the various challenges which life may uh, throw at us. So so if you feel stressed at any day, just put on to your, plug into your earphones and listen to music. So the cortisol levels which have got elevated because of stress will come down, and uh, the stress causing hormone cortisol will come down, and automatically we will feel that sense of uh, relief. What else? It will also increase the social connectedness. We feel more connected to the society and our loved ones. That's how it helps the in the terminal stages of our life, when somebody feels that I'm just going away from this world. There is nobody for me, and they're feeling that suffering. Music can help them to connect, to uh, you know uh, increase that sense of social connectedness, improve the you know sense of the symptoms of depression, and it can thus promote wellness, and also it can also improve their memory and cognition. So when we use music through our life, and particularly senior citizens are prone for dementia and things like Alzheimer's, music can delay the Alzheimer's, and even otherwise those who do, there are many of us who may not have Alzheimer's, it can improve the cognitive functions and thus help in uh, memory. So, with that word of thought, I would like to conclude saying that music therapy has long provided us with comfort, and it has helped wellness. But from the Indian side, we all need to work together and gather the evidence that needs to be gathered, and definitely work hard to publish more on the wellness potential of Indian music, so that Indian music gets its recognition and its well deserved place as for its therapeutic role in this world. Thank you very much.
Thank you, Dr. Vijaylakshmi. I think great points you brought up today, actually. And, Vedic Wellness University platform, what we are providing for this. So very well said today. Thank you.
Thank you for the insights, ma'am.
Thank you.
And now I request our another panel speaker,